Welcome to Cosmo Talks. I'm Petra. In this episode, we explore the shift from reactive to proactive health and how you can be a good host to your microorganisms. Because together, you form a fascinating ecosystem. And when the interaction is right, when the crosstalk runs smoothly, you flourish. Our health system is built on waiting until something goes wrong. You feel ill, you go to the doctor. Something is found, you're treated. The system responds to problems. But what if we could do it differently? What if we didn't wait for problems, but actively worked toward optimal function? This is the shift from sick care to health care, from reactive to proactive, from waiting until things go wrong to investing in keeping them right. And it starts with a fundamentally different question, not what's wrong, but what could be better. Many people think health is the absence of disease, that you're healthy as long as nothing is wrong. But health is a spectrum. At one end, clinical disease. At the other, optimal function. And in between, a vast area of suboptimal function that's never diagnosed as ill, but is far removed from flourishing. Most people are somewhere in that gray zone, not sick enough for a diagnosis, not vital enough to flourish. They function, they survive, but they don't bloom. The traditional system has little to offer them, no diagnosis, no treatment. You're healthy, they're told, while they know more is possible. Proactive health fills that gap. It asks not only is something wrong, but also are you functioning optimally? Science increasingly supports this shift. In 2023, researchers from the Institute for Systems Biology published their concept of P4 medicine in Nature Medicine: predictive, preventive, personalized, and participatory. Instead of waiting for disease, we predict risks early. Instead of treating, we prevent. Instead of one size fits all, we personalize. Instead of passive patients, active participants. This model requires a different way of measuring, not only diagnostic, is there disease, but also prognostic, where is this heading? Biomarkers that detect suboptimal function before it becomes disease, patterns that signal risks before they manifest, data that predicts trajectories. Your microbiome is one of the richest sources of such early data. A 2022 study in Cell showed that microbiome changes often precede the clinical manifestation of diseases by months to years. The microbiome is like an early warning system. It signals problems before they become clinically visible. This offers a window of opportunity, the period in which you can intervene before there's disease, but only if you look, only if you measure, only if you're proactive. At Cosmo Group, proactive thinking was the heart of our approach. We saw people who were technically healthy but knew something wasn't right. Their doctors found nothing. Their blood values were normal, but they felt their system wasn't functioning optimally. They were right. When we looked more broadly, microbiome, metabolome, functional markers, we saw patterns that traditional diagnostics missed. An entrepreneur in his mid-40s illustrates this. Generally healthy by standard tests, but chronically tired, poor concentration, frequent minor infections. His microbiome showed the picture, shifts toward patterns we associated with increased risk of metabolic and inflammatory problems. Not ill, not yet, but on a trajectory toward problems. We redirected that trajectory, targeted interventions based on his specific pattern. After 6 months, his energy was back, his concentration sharp, his infection frequency normal. He'd never been ill, but he was now healthier than he'd been in years. The aha moment. The absence of disease isn't the same as the presence of health. You can be technically healthy and still be far from functioning optimally. You can have no diagnosis and still be on a trajectory toward problems. Proactive health asks you to look beyond is something wrong. It asks you to invest in optimal function, not just the absence of dysfunction. This isn't hypochondria. This isn't obsession. This is recognizing that your body has more information than yes-no diagnostics can capture and using that information. The biohack, the function question. Once a week, ask yourself, how am I actually functioning? Not, am I ill, but do I feel energetic? Is my sleep restorative? Is my thinking clear? Is my digestion smooth? Am I resilient against stress? Note the answers. Look for patterns over weeks and months. This is your own early warning system. Before problems become diagnoses, they can often already be felt as suboptimal function. Listen to those signals. This was Cosmo Talks. Remember, you're not a machine that can break down. You're not a puzzle made of separate loose pieces. You're an ecosystem that responds, and that's good news, because every moment is a new opportunity to work on your biological age and your health. Want to discover more? Visit cosmogroup.eu. Until next time.